Good day, everyone. Today, we are discussing lung cancer, a malignant disease originating in the tissues of the lungs, usually in the lining of the airways. Lung cancer is the leading cause of cancer-related death worldwide.
What is lung cancer? Lung cancer is cancer that forms in tissues of the lung, usually in the cells that line their passages. It is the leading cause of cancer death in both men and women. There are two main types, the small cell lung cancer and the non-small cell lung cancer. These two types grow differently and treated differently. Non-small cell lung cancer is the more common type. Who more likely to develop lung cancer? Anyone can develop lung cancer, but certain factors raise your risk of getting it. Number one is smoking. This is the most important risk factor for lung cancer. Tobacco smoking causes about 9 out of 10 cases of lung cancer in men and about 8 out of 10 cases of lung cancer in women. The more years you smoke and the more cigarettes you smoke each day is the more your risk goes up. Your risk is also greater if you smoke a lot and drink alcohol every day or take beta-carotene supplements. If you have quit smoking, your risk will be lower than if you had kept smoking, but you will still have a higher risk than people who never smoke. And the next is second-hand smoke, which is the combination of the smoke that comes from a cigarette and the smoke breathed out by a smoker. When you breathe in second-hand smoke, you are exposed to the same cancer-causing agents as smokers, although in smaller amounts, and a family history of lung cancer. Being exposed to asbestos, arsenic, chromium, beryllium, nickel, soot, or tar in the workplace, or being exposed to radiation. For example, from radiation therapy to the breast or chest, radon in the home or workplace, certain imaging tests such as CT scans. And the next is HIV infection. Your risk is higher if you have HIV. However, smoking rates are higher in people who have HIV. So it's not clear whether the increased risk is from the HIV infection or from smoking. And the next is air pollution. Studies show that living in areas with higher levels of air pollution increases your risk of lung cancer.
Is to prevent lung cancer is first quit smoking. Kaya tayo nagkakaroon ng smoking cessation para ma-improve or ma-prevent natin yung tinatawag na lung cancer. Ito yung pinakamabisang effective ang pagpapatigil sa paninigarilyo ng isang tao. Pangalawa is to avoid second-hand smoker or ito yung tinatawag na kapag sa part ng family mo, family nyo or family natin may naninigarilyo, matatawag talaga tayong second-hand smoker. Why? Kasi yung usok ng sigarilyo ng isang tao is nahihinhil natin kaya tayo second smoker. Then pangatlo is wear mask outdoor. So dapat always tayo magwe-wear ng mask tuwing nasa labas tayo ng bahay para makaiwas tayo sa mga high risk area. Healthy lifestyle, panatilihin natin protected ang ating sarili sa pamamagitan ng exercise, regular exercise, pwede twice a week as long as nami-maintain natin yung lifestyle and then maintain na balanced diet. At saka, pwede rin naman yung sa yoga, pwede rin siya gawin sa bahay. Kahit nasa bahay, pwede rin tayong mag-exercise. Surgery na yung pasyente, pag inalis na yung tumor sa mga apektadong bahagi ng lungs, then magkakaroon tayo ng chemotherapy. Chemotherapy, isang uri ng pagpapagamot or therapy upang patayin yung mga cancer cells at pinapahina ito or slowly kills cancer cells para di ito kumakalat sa ating body. Then next is optimize respiratory function. Ito yung pamamaraan or strategy upang pabuti yung function ng lungs at system ng paghinga. Pain management. Layunin ng pain management is upang kontrolin ang mga sakit at mapabuti ang kalidad ng buhay ng ating pasyente o yung may lung cancer. The infection prevention. Iwasan natin magkaroon ng infection ang pasyente sa pamamagitan ng protective equipment. Dapat naka-protective equipment tayo tulad ng immunization gaya ng flu vaccine or pneumococcal vaccines. Anxiety reduction. Ang anxiety reduction ay makakatulong ito lalo na sa mga taong may lung cancer gaya ng relaxation techniques, cognitive behavior therapy para makatulong sa mga may negative mindset o tinatawag ang mga negatibong pag-iisip. Dapat stress-free lang si pasyente. Tsaka pwede natin siya emotional support, diba? Dapat suportado tayo kay pasyente. Dapat hindi tayo naghihinaan ng loob, diba? So, lastly is nutritional support. Dapat laging balanse ang diet. Mayaman dapat sa proteins, calories, and vitamins and mineral supplementation, and stay hydration.
Good day, everyone. I'm discussing about the signs and symptoms of the lung cancer. First is cough. Cough is a persistent cough that doesn't go away or changes over time. Next, wheezing and dyspnea. Difficulty breathing and a wheezing sound when breathing. Next is hoarseness. The tumor may press on nerves in the chest, causing a hoarse voice. Next is hemoptysis. Coughing up blood or having blood-thin mucus, sometimes sputum, is burned, indicating infection. Next is chest pain. Pain can occur if the tumor presses on nearby tissues or organs. Next is anorexia and weight loss. Loss of appetite and attentional weight loss are common. Next is weakness. Weakness is feeling fatigue or weak. Next, diminished breath sound. When listening to the lungs with a stethoscope, certain areas may have reduced or absent breath sound due to tumor blockage or lung collapse. And lastly, clubbing of the fingernails. The fingertips can become swollen and nails curve around them, a sign of long-term lung problems.
First off, when someone diagnosed with lung cancer, we know it's very scary thing. Basically, nababahala po tayo at natatakot. Now, I will go into more specific details behind the lung cancer treatment. The early stages of lung cancer starts on stage 1, and the lung cancer goes from 1 to 4 stages. So, punta tayo sa stage 1. So, sa stage 1, nangyayari po ang nabubuong fairly small cancer and it does not have a lymph nodes involvement. So, a stage 1 cancer treatment recommendation for this, if someone is in a good medical health, this time, they have lung resection for this. So, ang tawag doon is lung resection. So, for the stage 2 lung cancer, this would be someone who has a little bit larger tumor. The recommendation treatment on this is surgery immediately and adding chemotherapy after the surgery was done. For the treatment of the lung cancer stage 3, this getting a late stage. This also may involve a larger tumor and also may have some lymph nodes involvement more in the middle chest. So at this time, for this stage, multiple doctors needed, including chemotherapy, oncology, physician, radiation doctor, pathologists. They are all together for the preparation of the decision for the surgeries. So lastly, on a stage 4 cancer is when this cancer spread to an area of outside the chest. So, yun po yung stage 4. So, although the doctors don't matter about the cure for this stage, but they matter about the treatment. So, on this stage, medication is very interesting. And this time, patient has immunotherapies. So, which involve chemotherapy and immunotherapy at the same time. So, yun po yung mga treatment for the lung cancers stage 1 till stage 4.
Lung cancer diagnosis often start with an imaging test to look at the lungs. If you have symptoms that worry you, a healthcare professional might start with an X-ray. If you smoke or used to smoke, you might have an imaging test to look for signs of lung cancer before you develop symptoms. How to diagnose lung cancer? Baseline blood test, chest x-ray, bronchoscopy with biopsy, bronchoscopy, mediastinoscopy, fluoroscopy, image-guided percutaneous lung biopsy, sputum for cytology.
Etiology of lung cancer. The main cause is cigarette smoking, which accounts for around 85 to 90% of all cases. Tobacco smoke contains cancer-causing substances that damage lung cells. Secondhand smoke is also dangerous. Environmental and occupational exposures are another major factor. Radon gas, asbestos, and a polluted air increase lung cancer risk, especially for workers in construction, mining, or factories. Genetics also play a role. People with a family history of lung cancer or who have gene mutations like EGFR or ALK may be more vulnerable. Chronic lung disease such as COPD, pulmonary fibrosis, and past infections like tuberculosis can also lead to cancer due to long-term inflammation and scarring. Other contributions factors include older age, poor diet, immune suppressions, and alcohol use.